in terms of treatments available for skin cancer, it really depends on what type of skin cancer you have. Now, if we just take melanoma skin cancer, the best way to cure yourself of melanoma skin cancer is to have the lesion cut out. And if you have it cut out early enough, then you have very good chance of surviving it. If you don't, then it may spread and you may need chemotherapy or radiotherapy. So that's with melanoma. Now, with non-melanoma skin cancers, again, there are a range of treatments depending on how severe the cancer is. If it's very superficial in the skin, then various topical treatments like creams can be used, or we can do minor surgical procedures. So scraping the tumour off is usually sufficient to cure some tumours. When it's gone slightly deeper, the best way to remove them is surgery or radiotherapy. Now, surgery offers the best cure rates, and taking surgery another step forward would be something called Mohs surgery, which allows you to remove the tumour with microscopic control in a very precise fashion, and has less than a 1% chance that it will come back. And you don't get much better odds than that in medicine. So a Mohs procedure, when we say Mohs, it's actually named after a person called Dr. Frederick Mohs, who devised a way of removing tumours in a special manner and looking under the microscope immediately to see whether the tumour reaches the borders. A typical Mohs surgery will involve you coming in as an outpatient. It'll be carried out under local anaesthetic, under sterile conditions. We will remove what we can see with the naked eye, and then we will cut a very small margin around that. That will then be processed, and I will look under the microscope while the patient could have a cup of tea, eat and drink as they wish on the day. Once I then see under the microscope whether the tumour is clear or not, we'll go back and we will either take some further skin, but we will know exactly where the tumour is on the patient because we would have mapped it to the patient's body. So we'll know where to take further skin from. We won't take normal skin. And then once the tumour is clear, we will then close up, and it will be with stitches usually, and like any other surgical procedure, that they will be removed then in a week or 10 days later. So the benefit of Mohs is on the day, there's no waiting game. It's once we've cleared the tumour is clear, and we will see you for follow-up a week later. But that really is just to look at the scar and make sure everything's healing fine. There's no need for further follow-up or further surgery.